It's really the training and then the emphasis on how to treat a person. So in traditional Western medicine, you're kind of given, you look for these signs and symptoms, you diagnose, and then you come up with a treatment plan. Whereas within functional medicine, even though they're all physicians, nurse practitioners, registered dietitians, chiropractors, that whole realm, they just learn how to get to the root cause. They really understand where the problem occurred and how to fix it kind of within versus just treating with medications. We have a lot of nutrition training, which is really key, I think, in keeping people healthy, is looking to see what they're eating, how it affects their body. Is that food good for them? Diet is really the key component to staying healthy. So inside your gut, we just say the gut is kind of this midsection part of the body that has your liver, your kidneys, pancreas, and arteries, veins, nerves, everything is in there. So we call it the gut because it's the area of the body.
Right, like if you're going to punch someone in the gut, that general area you'd be aiming for, right?
So everything in that general area is really included in the gut.
Gotcha.
The GI system itself has a huge role for that, but when we look at everything, we talk about detoxing the body, that's through the gut. It's the intestines and the liver, that you're trying to keep moving and healthy and free of too many toxins. So it's just a general term. It really does kind of contribute to every system in the body. So, and we know that we have trillions of microbes that live in our gut that are also responsible for all the different ways our systems work. So we've kind of really discovered that there's more to it than just indigestion or bloating, or maybe you have an ulcer. There's really, if you're having depression, we need to think gut first. If you're having aches and pains, gut first. If you're having difficulty processing thoughts, or all of these chronic illnesses that we're seeing grow, autoimmune issues, and we really need to think gut first. What's happening in there? Is there a lot of inflammation? Is the immune system weakened? Is what you're eating causing these responses? Are you not breaking down nutrients, which is really a bigger thing than we think of. We eat healthy, but if we're not able to break them down because we're lacking healthy bacteria and enzymes, then we're just missing out on all of those nutrients, vitamins, antioxidants, things that really heal and keep us healthy. So it's personalized to everyone depending on kind of their toxic load, but you just want to keep the body as clean and pure as possible. You don't need to do these expensive cleanses or tons of supplements. Sometimes it's just reducing that toxic burden. So maybe it's reducing the sugar intake, which clogs up your liver and your pancreas, and that kind of reduces the ability to get things throughout the body, or working on your skin, reducing the toxic chemicals that we put on our body, drinking different water, eating organic foods. There's all different ways to detox the body, even mindfulness. So reducing the stress, which is a huge part of that. It's not always just the food. We have to look at the whole picture. So are you sleeping? Are you watching that stress? Are you exercising to get the blood flowing to sweat out some of those toxins? It's just the whole thing. See, we can use some of those detox programs to help encourage a quicker start, of the whole change. But for the most part, it's just looking at what's in your life that's adding more toxic elements in the system. And that we're eating so much too. I tell everybody, I think the reason we're seeing more gluten sensitivity and even dairy sensitivity is that back when we were younger and our parents were younger, we were having a sandwich a day, and that was it. We weren't having all these grab-and-go foods that when you look at the ingredients, it's wheat, it's egg, it's dairy, it's soy, it's all of these filler foods that I feel are just causing this toxic overload, and so we're not able to process those foods, and they're so genetically modified and they have all the pesticides on them that we have trouble just getting rid of them. So as I was saying, with the food sensitivities, when you find that you have one and you remove that, because when you're removing that, you're removing all foods with it in it, and that allows your body to heal, that inflammation to go down, everything to kind of go back to baseline. And as you reintroduce some of those foods that you're sensitive to, you'll end up not having the same issues because you've reduced that whole load. And now you're able to take in those foods at smaller quantities, more real, less, you want to eat foods that are like grown from the ground versus processed in a plant.
Right.
And then you're going to actually break down those foods, use them, and have less of a toxic overload.
What is that exactly, right? That's kind of another one of those key words, I think, or key
phrases. Leaky gut is, I would say, so common. Yeah. I mean, I could probably say a lot of, most of the people I see have it at some point, and it's coming from things like that. So the pesticides found on food, and again, eating foods that are inflammatory, whether they're bad or good, just causing that inflammation, and then causing that the lining to get breaks in the wall, and then those foods kind of going into the wrong area, and then you have this foreign substance in the body where it's not supposed to be, and that's where we're seeing this rise in autoimmune diseases, because we have this kind of foreign invader and the body attacks it because it's not supposed to be there. And so depending on where it attacks in the body, we see, increases in problems with the thyroid and even celiac or MS and all of these different things that we're really seeing grow. But it's because of these little breaks in the wall of our intestines.
Right.
I mean, it's this whole cascade. This is where the body, it's so fascinating to see the systems all kind of like a giant web, and they all work together in many ways. And so you'll start to see something happening in the gut, but then all of a sudden, your energy levels are low, you're having swelling all over the place, you're not thinking as clearly anymore, you can't sleep, you're always tired, all of these things get connected, and you have to just kind of figure out why is that happening. It just doesn't happen overnight. It's not just because we're getting older or, that whole myth is just not acceptable. Well, we've kind of gone over the inflammation, so we know certain foods that cause the inflammation. But when you think about pain, that's kind of where we really sometimes grab and go for those easy fixes that make you feel better fast and immediate. So it's easy to kind of grab those carbs, grab those sweets, just whatever to take away from the pain. But as we know, where our gut and our brain are connected, and they're connected by a nerve, our serotonin, which helps us feel better and go to sleep and help with the way we respond to pain, gets produced, a lot of it from our gut. So when we're inflamed, we're not eating right, our immune system's weak, all of our bacteria are off, we don't have that serotonin production as much, which actually increases the pain and decreases our pain threshold. So, as we repair the gut, that connection improves. And so just the pain itself starts to lessen because we're not feeling or starving our brain from the ability to not notice the pain, if that makes sense.
Yeah.
But, eating a very anti-inflammatory diet is also going to reduce overall inflammation. So whether it's acute, like what you're dealing with, more injury, those types of things, it will help the healing process faster. It won't completely take away from something that acutely happened, it's injured. I mean, that's normal inflammation.
Right, and that's where I think it's important to differentiate, because sometimes people get confused. Because in that case, like let's say I sprain my ankle and I get swelling at the ankle, that's actually a good thing.
That's a good thing.
That's the natural response of the body, sending more stuff to that area to help repair and to heal.
Right.
The problem is when it's a long-term thing. So like let's say I sprain my ankle, it swells up, but then it stays that way for like weeks or even years, right? Mm-hmm. Which is kind of what happens to people with, poor diet and they're eating those inflammatory foods. Mm-hmm. It's not just at the ankle, it's the whole body, but it's the same kind of idea.
Right.
That's where it becomes a problem, because that starts wreaking havoc all over the place. But like you're saying, just for like an acute injury or something like that,
yes,
it's not necessarily bad as long as we can help, facilitate that natural process, but then also help it to get past that as quickly as possible and heal that area of the body so it doesn't need to be that way for a long period of time.
Yeah, acute is totally different. Arthritis you can do a lot with through lifestyle changes. Arthritis is kind of that disease of aging. It's inevitable. We're going to get there eventually. But a lot of people are getting there so much earlier because of what they're eating, not sleeping. The stress is really a big thing too.
Yeah.
Weight is a big thing. So, keeping our weights in a healthy range is really essential for healthy body function. I see so many patients who come to me who've been put on antidepressants who are kind of frustrated. They don't want to be on that antidepressant. They want to figure something else out. And as we start to improve their diet, really, their nutrition status, their overall gut health, get those good bacteria, populated in there, good enzymes, reduce the inflammation, they feel great. They don't need it. And I see kids with ADHD who are also that big kind of target right now too. It's like any kid who's having developmental issues or behavior issues in school is told they have this disorder where when you really look at those kids and talk to them, they eat the worst diet. So starting right there improves their behaviors so quickly.